So I have the honor of introducing Dr. Stephen Houghland. Dr. Houghland is the Chief Medical Officer of the Kentucky Primary Care Association and the KPC Clinically Integrated Network. He's a general internist by training, and Dr. Houghland completed medical school and his residency at the University of Louisville. After residency, Dr. Houghland served a year as Chief Medical Resident and Instructor in Medicine. He continued on as faculty in the Department of Medicine for over a decade, rising to the level of Associate Professor. While at U of L, Dr. Houghland also served as an Associate Training Program Director and the Chief Medical Officer of the University Physicians Associates and University of Louisville Physicians. Dr. Houghland later transitioned to become the CMO for Passport Health Plan, a Medicaid managed care plan, and he did that for another decade before joining the Kentucky Primary Care Association. Dr. Houghland?
Thank you. I'm going to use both mics. I probably will actually just transition to the... Can you hear me? Okay, great. So thank you. I realize that my bio is way longer than what I thought it was, so I apologize for that, but it does make me feel good about myself. Just kidding, kind of. So thank you for inviting me. I really appreciate it. It is great to see people again. I see some old previous colleagues. I'm a little bit getting long in the tooth. I start to realize, based on how long I've been doing this. You know, when I was asked to give a talk, and it was a TED-style talk, I was excited and also a little nervous. I like it because I tend to move around, but I've also envisioned the little headphone with a little mic that could be distracting, and so I don't have to deal with that. But, you know, and I was like, okay, well, this is an easy topic, you know, quality. How long do I have? 15 minutes. It's like, oh, I was thinking more like 8 hours. And so, you know, so what is quality in healthcare? Yeah, so I did take a couple of notes coming in, and a disclaimer, I did not use AI for any of this presentation, knowingly. But in the back, the reality is that it does happen. Anytime you go online, something is driving selections of what pops up into your browser and the filtering through it. So, and I'll try to remember to come back to that and at a little bit later in the talk. But, you know, I'll go back to some of my professorial roots, definitions. What are we talking about? And so quality, I'm already using the word, but what is it? So Merriam-Webster's, good old-fashioned, can actually find it, not using Wikipedia, defines it as the standard of something as measured against other things of similar kind. Pretty direct, right? Or circular, maybe. And then the Institute for Healthcare Improvement, what do they say about it? Love this. The endeavor of continuously, reliably, and sustainably meeting customers' needs. Looking at 6 domains. I won't name all 6 of them, but safety, effectiveness, very important. Patient-centeredness, we'll come back to that in a little bit. Timeliness and efficiency. So then, well, efficiency, what does that really mean? Well, I think today we talk about value in that a lot. And sustainability, I would also argue, talks a lot about value. And so, you know, what is quality? Well, I think I would offer that it is different depending on the lens that you're thinking about it from. Where you are in your seat. What is important to you? What is your perspective? And so, to that, how many healthcare providers are in the room? How many purchasers of healthcare are in the room? How many large employers are in the room? So there was a little bit of a trick question in this, kind of a little smoke and mirrors. I would offer that almost everyone in this room is actually a purchaser of healthcare. There may be a few that are not, but either directly through your coinsurance copays, if you're paying out of pocket totally, you're contributing in tax dollars to state and federal programs, For your premium contributions as part of a self-insured or employer-sponsored plan, almost everyone in the room, there's a few caveats that exist in the United States today, but it's not the majority. But we don't tend to think about that, and you're not alone. I think most people tend not to think about that. And so so depending on the sector, though, that you're coming from, the lens you're thinking about it, as the individual that is consuming health care, quality may mean one thing. As the individual purchaser, it means something. As the company that's purchasing on behalf of its employees, quality probably means something else. And as a provider, I would say it also means something different. So I say all that to come back to, I think part of the problem we have is that we use terms very commonly. We often think they're synonymous, but they may not be, depending on who you're talking to. And that's one of the challenges that we have, is what is quality? Well, I would say it depends on what role you have and how you think about it. And how you then measure that becomes difficult. Because for a provider, they're going to think about quality often, ultimately, by what is the outcome, what is the result. But there are steps to that result. And so they're measured on process and then the hard outcome. And then it becomes alphabet soup. What are those outcomes? What are those process steps? Often coming from regulators or from someone outside, but whether it's HHS, HRSA, CMS, CDC, NIH have different standards, criteria, state, local, CHFS, DMS, DPH, different things they look at. Health plans look for something different. Systems that employ providers also look for something else. Even before I go any further, provider. What comes to mind whenever you hear provider? Anyone? Excuse me? People doing the work. So typically, most people think about a provider as an individual. At a system level, though, with regulators, insurers, provider is an organization or facility. They think about brick and mortar with provider. We think about people. So there's a disconnect there even. Within regulatory world, other places, that's more of a practice. We call them practitioners or clinicians. Providers are generally bricks and mortar. So again, disconnects, language, really important. And then on the consumer side, what do they think about as quality? So providers, it's, controlled blood pressure, diabetes controlled, less than 8 or less than 9, depending on whether it's federal or whether it's something else. Preventative screenings, colon cancer screening, extremely important. Thank you, Dr. Jones, for what you do. Consumer, what's important to them? Well, when I started in 2000-ish, the market analysis said that the most common reason why people chose the clinician they would go to or their provider, their bricks and mortar, was how much out-of-pocket expense did they have? How close was it to where they wanted to be seen? And that was generally for preventative services. They liked to get care close to where they lived. Close to where they worked. If they were sick, close to where they lived. A little different for kids, but for adults, that's generally how that broke down. What was in their network, so out-of-pocket expense. Guess what wasn't there in the top 5? How the quality of care that is being rendered. There was an assumption that if you could take part in providing health care, that the quality was there. Today, what is it? Still a lot of the same. It's shifted a little bit. What people believe to be markers of quality have tended to increase. There was something that was published in 22 by the NIH that talked about this. It was a survey. Well, there's an issue with the way the surveys are done. As compared to market analysis, which looks at survey and behaviors. where the surveys are just what people self-report, obviously. So in 22, things started popping up a little bit higher. How long someone had been in practice started moving up into the top 5. But the primary drivers were still, are they in my network? How much is it going to cost? How accessible is it? Both in distance and do they have an appointment whenever I want to be seen? That's actually moved up even further. So how do people know? Well, one of the things that has popped up in that surrogate for quality has been Yelp. It's supplanted, personal referrals, but online tools have now moved up. It's like TripAdvisor. You go like, what are good restaurants when I'm going to the city? Applebee's, O'Charlie's. They're fine, but that's not necessarily fine dining if you're looking for that. But Yelp, some other these, and not to pick on Yelp, but some of these other surveys of online for healthcare discrimination, or discernment is a better word, are easily flawed and manipulated at times because of the way people are now optimizing social media and the results. So why do things pop up in your browser? Your history. But also there's social media optimization and website optimization that happens in industry. So, and you've seen this, I'm sure. Things populate based on what's out there. So again, it just becomes really complicated to talk about, what is quality without defining what sector are you talking about, what is important to them, and then understanding what is that motivation. For clinicians, I would say that there's also the challenge of the delivering quality care at the individual level and trying to do no harm, and then realizing that from a population level, those don't compute. Then when you just only look at results, you have to look at process, and you have to look at the sustainability, and that involves cost. And so what is really cost-effective care, to me, is more of the definition of quality and value. And so how do you figure that out? There are processes, there's ways of doing that. It's looking at data, it's looking at results, it's finding the things that are outliers that need to be excluded. It's really comparing more like to like versus just the total population to really be discerning in it. But it's really hard for people today. There's more information out there, but there's not a lot of ability to understand, is this really true for what I'm looking for or not? And, in someone that lives in healthcare, it's still hard. It's still hard. But I think part of what we need to do is work on defining a little bit more, being comfortable with saying that value and sustainability is important. It is important. And for us, at the Primary Care Association and our network, part of what we're talking about is that sustainability and value. And it's a combination of processes and results that do take into account the individuals, but also how does it impact the total population? And for us, that's about 400,000 patients that are seen in value-based contracts. But how does it impact the population? How can we make that sustainable? So I have been given my hook. Happy to stick around for questions later, sorry. It's one of those things, you're given a question and you answer the question you want rather than the question that you're given sometimes.